A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Today I'm going to talk about a very brief introduction about the subject of insulin resistance and how you can treat it to be lifelong healthy. And this is going to be an introduction to our coming workshop arranged by the uh, association. And insulin resistance is the most common health disorder in the world. Uh, it is the root cause of all chronic diseases such as diabetes, hypertension, chronic heart, and chronic kidney disease. Now, if we speak in Bangla, insulin resistance হচ্ছে বর্তমান বিশ্বের সবচেয়ে সাধারণ স্বাস্থ্য সমস্যা। এটি ডায়াবেটিস, উচ্চ রক্তচাপ, দীর্ঘস্থায়ী হার্ট বা কিডনি রোগের মতো সমস্ত দীর্ঘস্থায়ী রোগের মূল কারণ। Now, this association is not easy, and why it happens is a very complicated issue. But suffice it to say that insulin resistance develop around the age of 40. When people get older, they naturally there is some metabolic changes that happens, and it is also associated with overconsumption of carbohydrates that a person is very used to because carbs are the source of energy. And then when a person is sedentary or not moving much and they get excess body fat and there is predisposition, genetic predisposition and vitamin D deficiency, all this can combine to make a person insulin resistance. And many of the chronic diseases that we know, such as say diabetes, hypertension, heart disease, lung disease, kidney disease, liver disease, dementia, hypothyroidism, polycystic ovarian syndrome, PCOS, or polycystic ovarian disease, are all related to this condition, which is actually like a pre-disease. Insulin resistance, very little symptoms and doesn't really bother a person except that he is a little bit fat and has some other sign symptoms, but not much happens. So people just ignore until they develop a full-blown disease, such as say obesity. The person is fine, can move and has no real sign symptom, but over the time period of say 10 to 15 years, they will develop diabetes. If the person has hypertension, then it might lead to stroke, or if he has fatty liver, it might go to cirrhosis if this condition is completely untreated. And so our strategy is that we want to treat disease at the pre-disease level. So there is a thing called say pre-diabetes, which happens in case of obesity. So we want to treat diseases before they happen because the insulin resistance develop 10 to 15 years before the actual disease. Okay, so if we understand insulin, it's an anabolic hormone that is secreted by the islets of pancreas. After you take meal, your blood glucose rise, and which is sensed by the pancreas, and then it secretes insulin, which lowers the blood glucose. And the way it does, it moves the glucose from the blood into muscle, fat, and the liver. Insulin is an anabolic hormone. It will build things. For example, it will be making lipids. So it will cause triglyceride synthesis, and it will build proteins as well. With carbohydrates, it uses the energy. So basically, insulin uses the energy from carbohydrate, that is glucose, and it let the glucose enter into the cell. That's how it decreases the blood glucose level and makes lipids and proteins. And so this is done by recruiting GLUT4. This is a glucose transporter 4 into muscle cells and fat cells. And insulin will let the glucose enter into fat and muscle. So if somebody is working that is very active with the muscles, then the blood glucose can be lowered. But if not, then this excess glucose will go mainly into the fatty tissue, which is why in case of insulin resistance, people become fatty or develop abdominal fat. And so when the muscle is inactive, that is the person is sedentary, the blood glucose is not lowered by the muscular activity. So the glucose will mainly, the insulin will mainly move the glucose into fat cells, which will cause hypertrophy and hyperplasia of the fat cells, which is more and more fat. And then ultimately this will lead to excess synthesis of triglycerides, which is a diagnostic feature of the insulin resistance, as we will see soon. So pathological increased level of insulin, what happens is this insulin over time, because of this fatty tissue that develop in different tissues, the insulin becomes resistance, which means you need more and more insulin to have the blood glucose lowering effect, which causes hyperinsulinemia. And this hyperinsulinemia will be increasing the free fatty acid triglyceride and ultimately will cause dyslipidemia. So how do we diagnose insulin resistance? Well, we can diagnose from the sign symptoms, and that is the person most likely will have some excess belly fat. Then there is a thing called acanthosis nigricans, which is these areas of dark and thick velvety skin due to hyperinsulinemia, which indicates, the insulin is overactive in some tissue, ectopic or where it should not be. And you can see this, in the black velvety areas called acanthosis nigricans, and then skin tags. There are small tags, and these are more associated with people who has both diabetes and hypertension, and is atherogenic, means cardiovascular problem they may have. Typically, in the laboratory setting, the insulin resistance is diagnosed by HOMA-IR, this thing called HOMA-IR, which is basically a multiplication product of insulin and the serum insulin and plasma blood glucose. And the cutoff value in the Western world is considered somewhere between 2 and 3, but in Bangladeshi setting, we'll use 1.7 to say that somebody has insulin resistance or not. And a good measure in the clinical setting, that is without any clinical laboratory test, you can do this height to waist ratio, which is if the ratio is 0.5 or less, then it's okay. Other than that, we will be considering as insulin resistance. And this height weight ratio can be easily used to as a prognostic marker or how well the patient is responding to treatment, because it's so easy to do in the clinical setting. Okay, so how can we treat the insulin resistance? Well, it's very similar to treatment with basic diabetes treatment with a little bit of changes. Basically, you try to modify the lifestyle of the person. If the person is taking too much calorie, you say you have to decrease your calorie, so a low calorie diet. And carbohydrates are one of the main problems, as we've seen before. So we decrease the carbohydrate, we decrease the salt intake as well, which can be associated with hypertension. And then, these days the processed food, and especially people who drink juices. So when we drink juices, the blood glucose level very sharply rises. So any juices such as say the high fructose corn syrup juices, the cold drinks, and then milk, they raise the blood sugar very high. So we avoid all those kind of food such as say rice, sugar, milk, potato, white bread, things like this. Then you do exercise. This will also help in reducing the blood sugar level, and then if you do intermittent fasting from time to time, that also helps. So this kind of lifestyle changes really helps. And finally, there are some drugs, and then drug usually we will do in combination. There are many drugs that can be used to treat diabetes, but only a few medication is available to treat insulin resistance, because not all anti-diabetic drugs will work to combat insulin resistance. So metformin is one of those rare ones. There are a few, depending on the condition and what kind of pathology the patient is suffering from, we will use it. So, but this, if one can do this kind of treatment, that is lifestyle changes and medication, most of them will be okay. So in the Healthy Lifestyle Center, we have started treating cases of insulin resistance with some success, and we provide some unique services and we will give many tips to the patient, which are very novel and which arises from our research work for the last 25 to 30 years. And our services will include, of course, medical treatment of the insulin resistance, and then we determine the patient's metabolic health by monitoring his height, body weight, and BMI, the body mass index, and blood glucose, uric acid, and cholesterol. And this we do with the POCT devices, which I will explain shortly. And then we will give unique dietary and lifestyle advice to keep the blood glucose low. You see, whatever diabetes or metabolic problem is there, one of the goal is to reduce the blood glucose by any means you can, right? If you can do exercise, intermittent fasting, low calorie diet, low carbohydrate diet, everything, the goal is to reduce the blood glucose level. Then we have formulated some unique meal plans for managing IR. And then we will do this test called blood glucose, uric acid, and cholesterol 2 hours after the patient's meal of choice. If you have any meal that you would like to have, then we can test it also. And then, of course, we do regular follow-up. So this is a sample prescription that, well, the actual treatment is missing below. But what I'm saying is we will do this screening OGTT. OGTT means oral glucose tolerance test. You see, in insulin resistance or in diabetes, what happens is that the patient, they are unable to control the rise in blood glucose after they take only 75 gram glucose. 75 gram glucose is nothing. It's like 2 big sweets in Bangladesh. Okay, so you can see here the patient's fasting blood glucose is normal, and this is why he was never treated for diabetes. By the way, he was obese, he had hypertension, but he was never treated for diabetes because his fasting blood glucose was normal. But when we do this skin, when OGTT normally is not done in a clinical setting, normally it's not done. But as I said, there is very strong correlation with insulin resistance and this OGTT. Normally, when you are insulin resistant, you will show impaired glucose tolerance test. That is, your body cannot decrease the blood glucose. See here, within 30 minutes the blood glucose is rising, and then after 60 minutes and 2 hours the blood glucose is very high, 14. So the definition of diabetes is that if the blood glucose after taking 75 gram glucose at 2 hours is more than 11 millimole per liter, then it's diabetes. Okay, and you can see that after our meal, our kind Dr. Kabir's low carb meal, the patient blood glucose are completely below 10, and actually it is like 7.3, which is very good. So the blood glucose did not rise at all, which is very good for the patient. So we do this OGTT with this point of care testing devices. Means patients do not have to go to a pathological lab for testing. We just do with the glucometer and other meters for uric acid and cholesterol, which is very convenient and cheap for the patient. We give it like a package, and we give enough time to the patients to make him understand what he needs to do for treatment. So this is a sample of our low carb meal. But we have devised many others, and it is very scientifically based. As you can see, it did not raise the blood glucose at all. This is another meal which is also very interesting. Now this one is a high carb meal, means carbohydrate is quite high. You can see that most of the thing here is carbohydrate, except this is protein. You have dates, you have sweet potato, which is very unusual in that sweet potatoes, if you have to cook them in certain ways and then put butter on it to make the glycemic load lower. Otherwise, sweet potato is very high carb diet. These are all carbohydrate, but you can eat them without much problem or without worrying about rising your blood glucose. But of course, we will do testing on the patient with this kind of meal, whether his blood glucose is actually rising or not. So I thank NDFA for arranging this workshop, the Nutritional Diet and Fitness Academy, on 29 December. Please join this workshop. It's only 800 Bangladeshi taka for a 2-hour presentation from 8 to 10, where I will explain this and many, many more things I will say. So please join, and thank you all.